there's 4 to 5 times more deaths on a yearly basis from heart attack than there are trauma. So we've got this tremendous and needed investment in trauma, but we don't have that level of organization for a much more common problem. Hospital in every location has sort of individual ways they deal with this, and actually, if we look at it, we can probably apply some standardized treatments around the state and standardized ways to get these patients the care, and that involves different folks from different hospitals getting together, different cardiologists, different EMS personnel, and really, I think the SCHA has done a great job in organizing that. They're the perfect sort of organizations to get us all in the same room. Not every heart attack is what we call a STEMI, which is the most serious, acute kind of heart attack. And all of that is, recognized basically on the EKG. But the technology's out there where EKGs can be done in the field, transmitted to a hospital STEMI center. And so a person could be in a rural, say Chiraw, for example, and it'd be theoretically possible. It is not theoretically, it's possible for a doctor in Florence, say, or here in Columbia, to look at that and say, yes, this is a STEMI, bring them right to us. There's no point in going to your local hospital where the STEMI care is not available. Bring them right to us. We can get the personnel notified on site, waiting for the patient. Typically, if someone goes to a local emergency room, by the time that STEMI is recognized, by the time someone is called for help, there's probably a 90-minute delay in transporting that individual. The goal is to get everyone, from their homes or wherever they have their event to a catheterization laboratory table with that vessel starting to get open by 90 minutes. So if they're lying around in an emergency room someplace waiting for things to get organized, damage is occurring and the patient's suffering the consequence. Yes, we think just about anybody from any region of the state theoretically could get to an institution that can get that vessel open. We think we can get them there more quickly if we do sort of the same organized approach that hospitals are doing, if we can apply that all over the state. And so that's really the goal of Mission Lifeline.